Hello everybody, it's Dr. Joel Lindeman with Lindeman Chiropractic. I just wanted to talk a little bit today about pregnancy and chiropractic. I've had the tremendous fortune of treating quite a few pregnant women lately and treating them right up to the point that they're ready to deliver their babies, and also been able to treat the newborns, 1 week old, 2 week olds, a couple day old babies, which is outstanding. There's nothing better than holding a little baby in your hands and making sure that their spine is aligned properly. It's a pretty cool feeling. But I've had other patients look in and they're amazed that we can treat pregnant women, and especially amazed that we can treat newborns. And I just wanted to talk a little bit about how we do it and why it's important. First thing, when we treat a newborn baby, everybody pretty much knows that their spines are mostly cartilage, so they're very gentle. The adjustments are not a big rotational push. It's not a big karate chop, as I like to call it. Basically, with a newborn baby, their spines are so small, I can adjust them with my 2 fingers. You find the misalignment, you do a little push like that. And the coolest thing about a newborn baby, a lot of times they help you. Instinctively, we palpate down the spine and we find a misalignment. And as we're ready to help realign it, the baby will arch back and put their pressure against my fingers, using my fingers as a lever, and it helps me just align that vertebrae like that. It's very, very easy, very safe, and it's pretty awesome. Why do we do it with a newborn baby? Is because, even a normal birth process, there's a lot of turning on the head. The baby's in a strange position. There's going to be a lot of misalignment because of the way that the body has to sit inside the uterus and through the canal, and then because of the delivery process. So things that can happen with a baby, actually, in my office we'll just talk about that. We've had some parents bring their children in because they're having GERD, basically reflux, and in an adult, reflux from eating pizza or nachos and things like that, or even just if you have GERD for another reason, it causes burping or belching. With a baby, they don't just burp, they throw up. So they spit up. And that can be a problem. So, we check the spine for misalignment, and a lot of times in the middle of the spine, where the nerves happen to go to the esophageal sphincter, the esophagus, and the stomach, if there's misalignment there, it can cause too much contraction of the esophagus or too much of an opening. So, helping realign the vertebrae, helping get the nervous system right, helps that problem be resolved. The other thing, we've had a lot of babies with ear infections. Even for the first couple of years of life, we're treating babies try to get their immune system better through chiropractic and auricular therapy. And if the immune system is functioning right, then they don't have as many ear infections. So that's been a good thing. We also treated a child that I'm thinking of right now, is about a month old, whose parents were told that they may need to have surgery on the little boy's neck because he didn't want to turn his head to the right. His muscle was contracted so much here, it hurt for him to turn. At least that's what we say. Babies can't say they hurt, but he never wanted to turn to the right. He always slept on his left. So they were going to have a consult with an orthopedist, which they were going to look into it and maybe do some physical therapy as well. But they brought him in here on the recommendation of another patient of mine for me to check him out. And as we started checking him out, I found a misalignment up at the very part of the neck, which is basically the second cervical right underneath the back of the skull here. And basically real light adjustment to that, and it took 3 or 4 adjustments, and the baby's turning to the right 100% now. It doesn't need to have the consult. Everything's going fine, which is pretty cool. He also had GERD, like I was another patient had that I was just talking about. We helped him with his GERD issues too, so that's pretty awesome. As far as pregnant women, why do we treat pregnant women? One, like we said, is most women know that have been pregnant, there's going to be some back pain, not always, but pretty significant portion of the time, because of the fact, if you picture the spine like this, you add another weight to it here, it shifts this curve forward, which pushes the hips forward like this, puts pressure on everything here. The disc can be compressed, nerves can be irritated, sciatic nerve can be really mad at you from getting pinched, so chiropractic can help with that. But even more so, the nerves control everything in the body, so if there's compression in the nervous system, and those nerves happen to go to the uterus or happen to go to other things, it can cause more damage besides just the spine being misaligned. Our job is to take the pressure off the nerves so the body can thrive, basically. That also comes into play with women. If a pregnant woman and the baby is breech, if the breech presentation, sometimes they'll try and do an inversion where they'll have the baby forcefully turned in the uterus, which sometimes needs to happen, or they'll do a C-section no matter what because the baby won't be birthed the way it should. Or you can actually deliver breech babies, but through a chiropractic technique, if the belly's pulling forward too much and there's constraint on the sacrum, go back here, it'll torque to the side, which pulls on the round ligament, which attaches to the uterus. It'll take that, if you just look at the uterus as a balloon, instead of being like this, it'll pull it to one side so the baby doesn't have room to go the way he's supposed to, so he's going to head up, or he or she will have head up instead of head down. If you take the strain off of that, by real easy adjustments, again, real gentle adjustments, but you can take the strain off of that sacrum, work on some muscle release in the front, get that uterus to line up like it's supposed to, the baby will turn, and it can help for a more natural and safe delivery. Other things that hack with pregnancy and chiropractic can help with is swelling in the feet, again, compression to the arteries and veins because of misalignment in the spine, because of muscle strain, we can help with that. Carpal tunnel, a lot of times people get, pregnant women get carpal tunnel because of compression to the swelling basically here, but if you can open up the joint the way it's supposed to with the gentle adjustments, the nerve can flow like it's supposed to, and the blood vessels can flow like it's supposed to, so that there's not that compression on the nerve. Headaches, a lot of times, we can help with all that. It can go on for days, but the biggest thing is not only is chiropractic safe and beneficial for the pregnant women, it's also very safe and beneficial for the baby that's inside the fetus, so inside the uterus. So chiropractic not only is a good idea, it's almost should be done. Should be checked out if you're pregnant to make sure that you're healthy, your nervous system's healthy, and your baby's got a better chance to be healthy as well. So again, I just wanted to touch base on it a little bit. I love treating everybody, honestly, but I love treating pregnant women, and little kiddos always had a special place in my heart for me to treat them, to make sure if their spine's right, their alignment's right, their nervous system's right, they have a better chance starting a leg up, instead of having minor complaints that we consider minor, even turning into major ones as life progresses. So my job is to get you back on your path to health with Lindemann Chiropractic. If you have questions or comments, please give us a call or an email. I look forward to hearing from you. Have a great day. Thank you.